Hi everyone, it's board certified plastic surgeon Sean Doherty from Boston, Massachusetts, and I wanted to speak to you today about facial rejuvenation. What is it? Every day I have patients come into my office asking me for facial rejuvenation. I think it means something different for everyone because it really is based on what you bring to the table with your face and what your experience in history and damage is, and then what you'd like to do, how aggressive you want to be, how much downtime you can have, how much discomfort you can tolerate, and then unfortunately how much you're willing to pay to do that. So when someone comes in and asks about things that they can do to make their face look more rejuvenated, I do a thorough physical exam, ask about their medical history, and ask most importantly about any procedures that they've had on their face, specifically surgery, because anatomy and blood vessels could be different from where one would expect to them based on previous procedures. And that includes removal of skin lesions, traumas, and all non-aesthetic procedures. So there are four things that I think about one's face in talking about facial rejuvenation. That's the skin quality and texture. That's lines that happen, both dynamic and static lines. So lines around the eyes, around between your eyebrows and your forehead. And there's lack of volume, so loss of volume typically in the mid-face, and then descent of skin. And so those are four things to address when we're talking about facial rejuvenation. I'll talk about them kind of briefly, and then in further videos, we'll kind of explore each subtopic. So the skin. Someone who has a sun damage and who has not used sunscreen extensively and hasn't really done a lot to their skin can actually make a lot of headway, but they need to do a lot of procedures. They could be doing home treatments with aggressive skincare. They could be doing treatments with estheticians, which could be light peels, microneedling, or light laser procedures, or they could do things with me that would be a very heavy chemical peel or very heavy ablative laser resurfacing. And again, the ability to have any of those things or which is best for you is based on what you can do and what your physician thinks is best for you. Lines around your eyes and between your eyebrows and your forehead can be aging, and people can be bothered by them, and neurotoxins treat that, and that's what Dysport and Botox are. Those both last between maybe 3 or 4 months and have minimal downtime, and they're really sort of just standard. And once people get into the flow of facial rejuvenation, it's kind of like their baseline. So every 3 to 4 months coming to my office for Botox. Next is volume. As we age, we lose volume in our mid-face. And so the fat that we had when we were young and had nice full cheeks goes away and then starts dropping down. And so replacing that volume is the concept of really kind of mid-face volumization, bringing cheeks back up. And how is that done? It's done mostly with filler. And so that's hyaluronic acid. So it's a Juvederm or Restylane families. Those are injections that are done in the office with sort of minimal downtime and can last between 8 to 10 to 9 months. Like anything in my world that can be overdone, and so I'm sure people have seen filler in the mid-face that is way overdone, and there are cheeks that people can serve drinks on that are way overwhelming, or lips that are way overdone. And so you come to me and that's not going to happen to you, but volume is an important part of facial rejuvenation. Often fat is placed in the face. That's done typically with surgical procedures to help volumize. Now, lastly, we're going to talk about descent of skin. So if you're looking in the mirror and pulling your face back, up and back, and that's something that you like, then I'm most likely going to talk to you about a surgical procedure, and that would be a face and or a neck lift. That's a pretty extensive discussion, and look for further videos where I can talk about that more extensively. But things that you can do that are not a facelift, maybe you can't afford a facelift, you don't want one, or it's just really not on the table. There could be non-invasive procedures, which could be microneedling and radiofrequency procedures that can help tighten a little bit of the lower face. Volumizing the mid-face tends to help lift things up as well. And then something called thread procedure is a minimally invasive procedure that lasts about 8 to 10 to 12 months, where threads are placed underneath the skin and temporarily lift up, and they can help improve the shape of the lower face and mid-face, and often do well when combined with volumization as filler. So lots of things to talk about for facial rejuvenation. Obviously, I like talking. I'd love to have you come and see me and talk about it in person, but please look for further videos so we can talk about this more. And please reach out if you have any questions or comments. Thanks so much. Have a good day.